Hello, this is Rambhoru Dasi from the International Society for Krishna Consciousness. I am the person behind the blogspot on Bhakti Care, and my aim in creating this blogspot is to try and establish a platform of conversation where other like-minded persons, Vaishnavas, can enter into dialogue around the service of caring, spiritual care of other people, particularly people within their community. I decided to use this medium, although I'm very non-skilled in technology. I decided to try my hand at blogging through video cam and responses in the comment section as I work too many hours a day to do all that writing. And so I thought perhaps this could be an alternative to having to come up with a lot of content and engage in a more personal medium where we can bat back and forth what we're thinking in terms of caring for not only ourselves but the people around us. Before I go on, let me just introduce myself to people who don't know me. I have kind of been studying for the last 13 years and have not been very visible around the ISKCON community circles, and became kind of compelled, inspired, prompted to enter into this dialogue or open myself to the ISKCON community as a resource after, hearing that we have some pockets of devotees around the world who have already started various kinds of dialogues and projects focusing on the care of other Vaishnavas. We have VaishnavaCare.org. We have now a hospice in Vrindavan. We have a wonderful hospital in Bombay. I've never been to them. I've heard lots of good things, and I've seen online some of their promotions and websites. Sangeeta Mataji has a wonderful book. I have never actually met her. I was introduced to her through the internet and the Bhaktivedanta hospice, and now we have spoken and have found each other as kindred spirits. And what I'm sensing is that there's a lot of interest in ISKCON for the care of a person in the dying process or when they're sick, which is really a wonderful thing. It is not exactly what I do as a chaplain or what I train people to do. The dying process is part of what chaplains do, spiritual care providers do, and of course it's a major part of learning how to accompany a person in a moment like that, the person who's dying and the family members who will be left behind. So it is certainly a skill that I have been trained in, as well as other chaplains and the chaplains that I train. But more importantly, for me, from a spiritual care provider's perspective, my interest in the Bhakti Care movement or vision is really about the people who are around us all the time. End-of-life care or palliative ministry is one part, but what we do as a chaplain or a spiritual care provider is really about accompanying people in their moment of crisis. And now when I say that word crisis, what often comes to mind is like a natural disaster, which certainly is a crisis. But in the spiritual care profession, we would interpret the word crisis as being anything that forces a person to make a radical change. So it could be getting a new job, it could be getting married, that would be a crisis. Having a baby, that is a crisis. Struggling with depression, that is a crisis. Someone saying something to someone that hurts their feelings so deeply or triggers a personal life history trauma or re-traumatizes them from something that happened to them in early life, that's a crisis. So we are all undergoing crisis all the time. I believe in Japanese, the word crisis, the interpretation or translation of the word crisis is an opportunity for change. So, as a crisis minister or a pastoral care provider, spiritual care provider, um, that's a huge piece of what we do in hospitals and hospices, but in parish settings or temple settings where um, part of a ministry of the community is to support one another. So that's, for me, the most important piece of the conversation as ISKCON grows and expands into larger and larger communities of people who are not living in the temple, but also people who do live in the temple. We are human, and we have a long journey between being totally ignorant and being totally enlightened. There's a very long space where we are not chanting purely. We have offenses, we have unprocessed stuff that we bring with us to the bhakti path. And as a chaplain, this is what I hope to bring. Some of the things I've learned, some of the skills I've learned, some of the self-awareness I've gained about myself and about my interpersonal relating with others, that I think that we all could benefit from talking about. So that's basically my introduction. As far as my qualification to do these things or to even speak on this subject, no, I'm not an expert. I'm a teacher. I have a bachelor's degree in religious studies. I have a Master of Divinity degree from Claremont School of Theology. I have a master's degree in patient counseling from Virginia Commonwealth University. I'm a board certified chaplain from the Association of Professional Chaplains. I'm a certified healing touch practitioner. I'm a therapeutic harpist. I use those modalities in my ministry of spiritual care. And I am soon to be, I'm actually a certified Association of Professional Chaplains educator, and soon to be certified as fully as an associate, hopefully in the spring. So some credentials, just to give me a little credibility that I've had some training, and I've read an awful lot of the literature, and I am constantly in dialogue with professionals in the nation around providing spiritual care to the hurting human heart. So keep tuned in. If you have comments or things you want to respond or questions you'd like to have or would like to ask me regarding what I'm talking about, please feel free to say something in the comment, ask a question. In my next video, I will use that as a jumping off point in my conversation. So Hare Krishna and be well.